Hello friends, we are here with a new case in which this was a patient having deep set eyes and the patient was having myocamia. He was squeezing his eyes really bad. We started the surgery as usual, but due to the deep set eye, we were facing difficulty in continuing the rhexis with the capsulotome. So we wanted to remove our capsulotome out of the anterior chamber, but at that the same time the patient squeezed and the whole lens complex moved from its place and also nicking the anterior capsule. That was a challenge, but at that time we kept our head cool and we gave the subtenon injection so that the patient become comfortable. Then we completed the rhexis with the capsulorhexis forceps. We try to keep the size of the rhexis around 5.5, and then we proceed with the chopping so as to exert minimum pressure on the anterior capsule as it was compromised capsule. After first hemisection, the one of the hemisection was just pulled out of the bag and emulsification was done in the anterior chamber. Similarly, the other hemisection was also lifted out of the bag and emulsification was done in the bag. These all maneuvers saved us from exerting more pressure on the capsule. In this way, we completed our phaco since it was a soft cataract, but there was also fear that it was a posterior polar look-alike cataract. So we gradually did our IA very gently, and look, we were very scared not to pull out the cut margin or the compromised margin of the anterior capsule. Gently we did IA and we found that the posterior capsule was intact, so that was a relief for us. And after doing thorough IA, we put the IOL in the bag, taking care of putting the haptic of the IOL perpendicular to the site of extension of the anterior capsular margin. Then the IA was done and the case was closed gently so as to exert minimum pressure. Thank you for watching. Keep watching.